How do you know that you have a pinched nerve in your neck? Well, if you have sensations running down your arm, you might have a pinched nerve at the neck level. My name is Huang Tran. I'm an occupational therapist and certified hand therapist. And one of the reasons why I'm sharing some exercises and movements and things about your neck is because a lot of people come here to our clinic for hand and arm related issues that are all really coming for the neck. Here are some of the symptoms you might be feeling that might be a pinched nerve at your neck. So if you have numbness and tingling, if you have numbness to this finger, to the thumb, the index, the long finger, and half of your ring finger, it's one particular nerve, and that's called the median nerve, right? But that nerve starts out from your neck, comes down your shoulder and past your elbow, past your wrist, and into your hand. And then you might have numbness on your small finger and half of your ring finger, and that's called your ulnar nerve. And that also comes from your neck down your arm, down your shoulder, past your elbow, past your wrist, and into your hand. So you're feeling any numbness or tingling, you might have a pinched nerve. If it's pinching all 5 fingers, it might be a nerve, it might be coming from the neck. If you feel a heaviness of your arm, like you can feel one side just feels heavier than the other, or you might have that heaviness throughout your both arms. You're just like, this doesn't feel good. This just doesn't feel normal. I used to not feel like that. You might have a pinched nerve at your neck level. You might have pain that radiates. So usually people, pain can be ignored, but when pain is radiating, most of the time people are like, wait, Huang, what's going on? Why is it, moving up and down my arm? So you might have pain. And a lot of times people ignore the pain, but what I've found here in my clinic and being a therapist for over 20 years is once that numbness is there, numbness and tingling, or that heaviness of their arm paired with pain, they're quick to run. They're quick to like go to the therapist or quick to go to the doctor. And the reason why I'm sharing this is you don't have to wait until it's so bad that now you're really worried that you might be at risk for having an injection or surgery, because injections or surgeries at the neck is absolutely no fun at all. So I wanted to share this video so that you can know, like, hey, this might be a neck issue, and have a really great conversation with your trusted occupational therapist or physical therapist. Now, a lot of times, you might think, oh my God, I need an X-ray or an MRI. And yes, believe it or not, you don't have to rush to get an X-ray and MRI. An X-ray just tells you what your bones look like, and an MRI tells you what soft tissues are going on. And they're like maybe like the canal of your spine or anything like that. And they have their place in helping you to diagnose what's going on. But one of the first things that you could do is actually get conservative treatment. And it's through your occupational therapist or physical therapist that can help you evaluate, hey, like, what's moving really well, or where are you limited, right? So if you're limited in how much your neck moves, right? Or how much your spine moves, your thoracic spine, that can all really relate to your joints of the cervical spine of your neck, and they're maybe not moving as well as you need them to move, so that it's not pinching on a nerve. Maybe you have some muscle imbalances that's causing that kind of pinchiness, that's causing you to have some of that numbness, that's causing you to have some of that heaviness or that pain. And believe it or not, one of the things that we do here at our clinic, and maybe by just talking to you a little bit about what we do at our clinic, this can help you to know what to expect if you're finding a therapist in your local area. Right, so as an occupational therapist and certified hand therapist, one of the things I look at is like the whole body. I look at the whole spine actually, and I look at all the spine because if you think about all the spines, they're stacked up on each other. And I'd like to take a look at all of them and make sure, like, how well is your spine moving? Because if your spine is not moving really well, it might be why your neck bones, right, your cervical spine is not moving really well. The other thing I'm going to look at is your shoulders. So I'm going to look at your shoulders. I might do some special testing to see how much movement your shoulder has. If you have way too much movement, that can be an indication of why you might have some pinched nerve types of issue. If you're lacking motion and you're feeling really tight and you don't have enough rotation, I'm always looking at rotation and saying, like, is your shoulder causing some of these nerve types of like pinched feelings of the numbness and the heaviness and that pain? You know, is it a neck issue or is it a shoulder issue? So we want to rule in and rule out, like, what's going on here. The other thing that I'm going to look at is I'm going to look at how the nerves are moving. So if all the nerves are coming out of our neck, down our shoulder, down our past our elbow and into our hands, I'm going to look at the whole nerve bundle and I'm going to look at how it's moving. And what you want to do is you want to make sure your therapist is looking at both sides of your arms. Like, I always look, you know, at both my arms. Like, one side tends to sometimes be a little tighter than the other. People who come in, you know, and get treatment from us here at Hands-On Therapy Services, we look at both, and there's usually a big difference in between the two. Now, there's other clinical testing that if you are experiencing things on both sides of your hand, for sure it's a neck issue, and we want to make sure we're looking at that and ruling in and ruling out, like, what is going on. And usually in that first session, we're gonna see some kind of change. There's going to be some kind of change. If we're doing our job, there's going to be some kind of change, and that's what we're looking for. If it's really bad, we might not see the change, like a huge change. We might see a small change, and we might need to have some follow-up sessions. But usually there's some indication, some change that we're looking for. When there is absolutely no change in anything, that's when your therapist, your trusted therapist, might recommend another specialist to come in and take a look. And that specialist might be the doctor, right? And so it's like, well, which doctor should I go to? Because there are a lot of different doctors that specialize in different things, right? And so if I, as a therapist, suspect that there's some bony types of issues going on with your cervical spine, the actual bones, I'm gonna recommend you to an orthopedic spine specialist or a neurosurgeon, right? Especially if it's at the neck. I don't know about you, but if it was me, I'd go to a neurosurgeon. And then if I suspect that it's more of a nerve issue, then I might recommend a neurologist, right? A neurologist is a doctor that specializes in the nerves. I might, if I suspect that it's really not a neck issue and it's more of a hand and an elbow and arm issue, I might refer you to a hand surgeon. So a lot of times when you suspect that you have a pinched nerve, find a trusted occupational therapist or a physical therapist who specializes in understanding the spine and how it affects the arms, right? And that's going to be your best bet into terms of finding out really what's going on so you can fix it really fast, right? Because the longer that you wait, the worse your symptoms are, and it just doesn't feel good to have this constant heaviness, the constant pins and needles and numbness. And the longer you wait, sometimes you're at risk for injections and surgeries, and those are not necessarily the first thing you want to jump to when it comes to, like, hey, you know, someone messing with my neck, right? So if you have any questions regarding a pinched nerve, those are some beginning symptoms that I can, you know, hopefully share with you and help you to consider getting some help, getting some professional help versus just, you know, watching YouTube videos like this. This is great just to get you aware of what's possible out there. But definitely if it's more of a nerve issue, it can be more complex than just, hey, do this stretch, or hey, you know, do this exercise. So let me know if this type of video helped you with your type of nerve issue. And if you like more videos like this, click the like button and subscribe to this channel, and that lets me know I can make more videos just like this. And if you have any questions, then feel free to leave a comment below, and that's going to guide me in terms of making more videos like this. Though, disclaimer, I cannot give personalized medical advice, but I can make more videos that can help you know there's some help out there for you. All right, thanks again for watching. Until next time, peace.